Okay. So I was at the end talking about rectal formulations. Hemorrhoids are painful swollen veins in the anal rectal area, generally caused by strained bowel movements in many cases, but there are also other causes, hypertension, increased blood pressure, which is basically the same thing. Sometimes with genetic predisposition, and sometimes the suppositories can be very helpful in reducing the pain. Also, there are over-the-counter drugs such as preparation H, which is used for the treatment of hemorrhoids. Okay, so we finished with the enteral route. Now we're talking about the parental routes. And remember, that's any uh, entry into the body of a particular medication outside the alimentary canal. So parental routes of administration, there are many different reasons why they are used. There are major advantages and disadvantages by giving formulations by the parental route. Injection dependent parental routes require a needle, some type of propellant device, syringe, pump, etc., to administer drug. Those are some of the key points to think about as we talk about parental routes. Okay, so parental routes of administration. We have the key word mean para means outside or beside, and enteral meaning the alimentary canal. Supplemental routes require an injection base, or some parental routes do not require an injection. These are injection independent, and other routes, parental routes can include patches, for example, gels, creams, electroporation, etc., to get the drug into the body. So let's look at the different type of injection routes, and we're gonna cover them. Those are injection independent. If you look over here, there's ophthalmic, which is associated with the eye. Of course, injecting into the eye would not be very good. Also, intranasal, into the nasal cavity. Injection, of course, would not be good. Inhalation through the mouth, for example, a nebulizer that's used for the treatment or prevention of asthma. Injection, of course, will be very difficult to get an injection into the lung to treat a systemic as lung respiratory condition. A dermal, it could be a cream, right? And then vaginal within the vagina, and otic, which is in the air. So these can be, in most cases, are injection independent. Injections that are injection dependent are anything that's going into the vein, intravenous, anything, many times things that go into the muscle. Much of the injections that go into the muscle is either in the deltoid, which is the arm, or the maximus, which is in the buttocks area, into the thigh, etc. Intradermal, which is within the skin. Subcutaneous, which is in the hypodermis, and that is a layer that consists of fat, is under the epidermis, which is your outermost portion that you see, the dermis, which is right under that particular portion, and then below that, for each muscle, is the subcutaneous layer. So people also call it the hypodermis. Epidural, going into the spinal cord, and intrathecal, which means Okay, intrathecal. When we talk about intrathecal, basically you're talking about occurring within or administered into the spina theca. Okay, so intrathecal administration is a route of administration for drugs via the injection into the spinal canal or into the subarachnoid space that it reaches the cerebrospinal fluid. All right, so let's take a closer look at that. You have parenteral routes of administration, including the IV, which will be going into the vein. Intramuscular, which will bypass the upper layer here, which is the epidermis. Here is the dermis. Here's the subcutaneous layer, some people call it the hypodermis, and then directly into the muscle. Subcutaneous, again, into the hypodermis area that's located here. Then you can have intradermal, which is between the dermal layers of the upper layer, which is called the epidermis. This here layer that you see that are the active cells that come to your keratinocytes, which produce your skin, and then the dermis that's located here that has nerve, smaller blood vessels, etc., and the medication in between those. Here are some of the different type of needle gauges and needle length depending on the type of administration route. If you have an IV, these are the type of drugs, the type of needles that is used. Needle gauge 16 to 20 if you're going into the vein, 19 to 22 if you're going into the muscle, subcutaneous 24 to 27, it's a little bit larger. And if you're going to intradermal, 25 to 26 would be your needle gauge. And then your needle length will be different. Notice that for IV and IM, it's much longer than for sub-Q intradermis. Intradermal, especially, you don't really have to go very far. And so your needle length does not need to be very long. So what's the advantage of the parenteral route? Well, again, we talk about challenges in relationship to drugs going to the stomach, the long time that it takes sometimes to get absorbed because of going to the small intestine and go through dissolution and disintegration. And so this is a preferred method of administration, especially in an emergency situation. It takes only about 20 seconds for blood to circulate through the circulatory system after being pumped. And so this works well. Another reason why, or another advantage, is if the patient is unconscious, uncooperative, you can give drugs through the parenteral route. So what is the disadvantage? Well, because, and I'll say this first, because it is so rapid, if there's a particular problem, we cannot remove that particular drug. You're already given it, has already gone through the circulatory system, and therefore it has a higher chance of side effects potential. At the area of injection, if you look over here, and I'm kind of going at a different, I'm not following from top to bottom here, infection, because you're injecting something into the body, whether it's a needle, IM, SQ, or SC, or into IV, different things within, it can lead for complications such as infection. Thrombosis can also occur, clotting, especially with IVs in that particular area. Unlike taking a pill, put on a patch, using a suppository that goes into the rectum or a gel, something along that line, you have to have skill finding the vein. You need to inject not into someone's bone, but into the muscle. So all of those require a skilled person to administer that type of drug. And because of that, there's a higher cost associated with those type of drugs in many cases. All right. So, what are some of the definitions that's associated with parenteral formulation or parenteral routes? Buffer system, ingredients in the formulation designed to control the pH, especially as it passes through the stomach, which has pH 1 to 2. A lot of times at the area of injection, you have necrosis or cell death. That could be one of the reactions to the needle, to the medication being injected in that particular area. And then those particular type of medication, definitely in comparison to oral medication, have to be free of microorganisms. Because what happens, it will just grow in a sterile environment out of control and there's nothing to stop them. Okay, let's look at the different types. I mentioned this already. With intravenous formulation or IV, the medications go directly into the vein. It takes as little or even less 20 seconds to circulate to the body. That means that if it's not the right medication or there's too much, it's kind of difficult to remove it from the body. And most of the solutions that are common to IV formulations are aqueous solutions. Two terms that you should be familiar with. One is called syringeability, and another one is called injectability. When we talk about syringeability, we talk about the ease with which a suspension can be drawn from a container into a syringe. And injectability, the ease of flow when a suspension is injected into the patient. Very, very important in relationship to getting the medication where you want to go within the patient. Let's again look at intravenous formulations. Intravenous dosage forms are administered directly into the vein and therefore directly circulate within the blood, as well as 20 seconds to get around the circulatory system. Injection suspension are difficult to formalize because they must be suitable to syringeability and injectability. We talk about syringeability, able to get from a vial and able to be injected into the patient. The emulsions are formulation that contain both aqueous and non-aqueous components. That can be also part of the intravenous formulation. Again, as mentioned, many patients do not really like the emulsions because of the oily taste that leaves in the mouth. And then dry powder formulation are manufactured for intravenous use, but must be reconstituted, and that means must be placed within a suitable diluent to make a liquid formulation that can be injected into the body. Okay, these are key concepts that you should be familiar with. I touched a little bit about this, and we're going to expand on this. Several different type of complications can be associated with intravenous formulations. Not only can you have infections, a major problem, you have thrombus, in which at the site of injection is a blood clot, and that can lead to stroke. Phlebitis, again, irritation of the needle into the vein, leading to inflammation of the vein. Air embolus occurs when the air is introduced into the vein, another thing that can cause stroke. And then if from the vial if it's not done correctly, we have glass pieces. Those glass pieces can cause serious damage to the patient. So this is some of the intravenous formulation complications. So where are the different type of popular injection site? Well, the most popular injection site that most IVs that go into is the median cuboidal vein. The median cuboidal vein that's located right here. This is what the doctor, the nurse first look for. A lot of times you see IVs that is injected into the dorsal venous arc. That's located right here. It's another place where you can put the IV. But other places can be the bacillus vein, the cephalic vein, right